Hi, I'm Ahava Leibtag. Today I'm joined by my good friend Jennifer Flax, manager of web content and strategy at Children's National, to talk about the future of marketing and what makes peds unique. You've got questions, we've got answers. Let's go. Thank you so much for being here.
Thanks for having me.
Jen, you didn't get your start in healthcare, but you've been in it now for over 10 years. What drew you to healthcare and specifically to a children's hospital?
Yeah, I had kind of an unlikely start in my career. I was an English major and I entered book publishing first. So I worked in science fiction and fantasy book publishing and then wanted to do something different, got a little more technical. So I kind of bounced around in like video game software and finance. And then after finance, that was when I decided I wanted to do something mission driven. And I know it sounds a little bit cheesy, but I am one of those people who I care about the company I work for. I care about what I do for a living. And you spend more than 40 hours a week doing your job. So it really was important to me to work in a field I cared about. In another life where I was good at math and science, I would have loved to be a doctor or a nurse. That didn't pan out. So I was able to take the skill set I do have and port it over to healthcare. Peds specifically, I didn't start in peds. I actually worked for a fertility center first, and then I worked for a different academic medical center in OBGYN, and then ended up in peds. It's just gives you the warm and fuzzies, even though for the families going through these challenging times, it's very hard, but feeling like you're helping families when they're going through such a tough time is really important. And that's part of what drew me to it. And honestly, it was a bit serendipitous because starting at Children's coincided with becoming a mother. And so that also was special.
Yeah, I always say that when you're a content creator or responsible for a content team, you're always better and worse off if you're part of your own audience. So, like, it's great that you're a mom, but then sometimes you'll take your own thinking about motherhood and put it onto your audience, which they may not be thinking that. So, I always say it's like a double edged sword.
100%.
You never really know. In pediatric hospital marketing, you're appealing not only to families, but also referring physicians, donors, and community stakeholders. How do you prioritize or segment content and messaging for those different audiences?
And it's unique to this business. And so, one very obvious but important way is that we have different sections of our website that correspond to those different audiences. Now, that doesn't mean there's anything confidential to one audience on one of those sections. If a parent strays into the referring provider section of the website, it's not a big deal. It's just the content's not directed at them. But that's one way we handle it. We work very closely with the various stakeholders internally and externally. We do a lot of surveys. Our liaison team will reach out to referring physicians to see what do you want from our website? What information do you need to get and how can we work with you to make that happen? We also have separate websites for some of our other audiences that we manage. So we have research, so that's has its own website. We have a foundation, they have their own website, and it all falls under our overall umbrella. So it's a lot of working very closely with the other teams. My own team that I manage, the web content team, they are divided up into beats. And for those in the audience who might not know what that means, it's essentially each person is dedicated to different areas. So that could be departments at the hospital, like someone has neurology, someone has cardiology, but it's also you're the person who handles most of the fellowship programs or most of the residency programs, because we also have education as one arm. Or again, for that referring physician community, because that really helps have someone become the subject matter expert in terms of what's on the website so that they can then work with those other partners to make sure the content's up to date, to find out what those various groups are looking for. And even from a deadline oriented standpoint, I mentioned the residencies and fellowships. That has an annual cycle connected with it. So our team proactively reaches out in the spring to those programs. What are the deadlines for this year? What content needs to be updated?
You will cover a tremendous amount. How do you handle that level of work? Can you talk about the dashboards you use or the software that you use for your editorial calendars? Like, how do you keep that all straight? That's a lot of web content.
That's a lot. We have an excellent team, a lot of folks on the team, and we also work very closely with our counterparts in marketing and PR and internal comms so that we're all staying up to date on what everybody's working on. There are various calendars. We have a million different Google Sheets keeping track of content. So we also have a variety of software tools we use. We have a ticketing system. So all of the web edits that are requested of our team come in through this ticketing system, so it helps keeps us organized. We're able to look back and see. We also have our own version of a wiki that we keep all of our various information.
That's really smart. You're the first person I've ever heard say that.
Oh, really? It's not actual Wikipedia, it's a different kind of software, but it's the same concept so that our internal team will know the different guidelines, how to manage not just the content, but like the layout of certain pages, how to do things on the back end of the website from a technical standpoint, because we like the different sections to be uniform and consistent. So a lot of different ways of staying organized. We love all the Google Sheets. We also use Slack, which I'm sure lots of companies use, but I think that's a really vital tool that we have because we can just check in throughout the day with each other and check on projects and have little groups for specific projects and whatnot.
Thinking about the whole AI conversation and how do you keep humans in the loop and how do you keep content human and all those things. How do you make those decisions about when a piece of technology should be assisting you? I'm starting to call it AI assisted content because I can't think of like another thing to call it because it's not AI created and it's not AI edited and it's just AI supported. I don't know. But how do you make those decisions about when do we use technology to help us and when do we just like get together as like human brains and figure this out?
Great question. So with AI, you have to embrace it. You can't ignore it. It's everywhere. It's impacting everyone. We actually set up ethical guidelines about a year or so back for the overall marketing and communications team to acknowledge the fact that everyone is using it, but we have to use it in ways that are acceptable to our brand and for our audience. And so on our end, what we try to do, the way you put it is assisted technology, I think that's a good way to describe it because it's a tool. We have many tools that we all use in healthcare marketing, but we're not letting it replace us as individual writers, editors, but also the brand, because I think one thing we've seen across all of the AI platforms is that the same things that always mattered still do, like authenticity, trust, expertise. So for the content that we produce, sure, if we have a conditions page on the flu, everybody has a page on the flu. I'm sure at this point, the various AI tools can give you a very succinct version of a flu page. So I'm not going to pretend we're going to stand out on the flu specifically, but there are a ton of things that we put on our website about all of the things happening at our hospital and our various programs, the work we do in the community, our research that it's unique to us or it puts our own spin on it. We don't care just about your child's physical aspect, though that's very important. We also care about the mental and emotional aspects of their care. So there are many things we talk about that you still need the human, you still need that authenticity. But if we're writing the content and maybe we need to make something sound a little crisper or a little easier to understand for the average person, that's where you go to your AI tool and you massage or edit a sentence, but it's not replacing a person. Like in the past, content that has any sort of medical aspect to it, you still have a clinician vet it, make sure it's accurate. But, it can cut down time sometimes, make that content a little crisper or plain language. It's always a huge issue in healthcare, and there's a variety of different tools for that, but it can help to say, hey, take this very technical concept and help me make it a little easier to understand for someone who has no background whatsoever in healthcare.
I think it's really important to like think of it like a tool. Like sometimes it can be really, really helpful. And then other times it's just like, okay, this isn't the way that I want to do this. When you were talking about having the basic page of the flu and you were talking about how there's nothing special that you can say about the condition page of the flu, but by your experts talking about how this affects a child's emotional development or other things, how parents can know how to monitor the flu or take care of the flu. Or that I was thinking about when the whole thing with Tylenol happened and I started doing research on myself, I really enjoyed the academic medical center, pediatric institutions' perspectives more than I enjoyed the general news media articles. I found that they were classic news media articles. We're talking about this, we interviewed these three experts, but when you actually had one institution with one or two experts from that institution giving real life examples, it felt like what people are talking about when they're talking about this authenticity thing, and that experience and that expertise and that authoritativeness came through from the point of view of an actual physician on the ground or a researcher who's looked into these things. Do you think that people look to you to be that expert and to give that color to these kinds of stories about health?
I think families, especially of children, they look to their pediatrician. I don't have the data, but generally families, they trust their pediatrician. Our individual pediatricians might not be the pediatrician of the parent coming to our site per se, but we're speaking from that same lens. We're giving you the clinically accurate data, and that's what we follow, and we do it in a way where we're without judgment, we're with compassion, with empathy, just addressing whatever questions families have. We also have a parenting blog. It's microsite of our site, but we promote a lot of that content on the main website and the social channels because it does give us the opportunity to have more of that conversation with families where, again, it's an actual real doctor talking to the public about different questions you may have. Like, is the flu worse this year than other years? How effective is the flu shot this year? Because it's always effective, but we know the efficacy changes. All the different topics that come up. It could even be, should I let my kid eat Halloween candy without any limits? Probably not, but things like that.
Can't text your pediatrician because they don't have time to answer everybody's individual question. But yeah, all of the pediatricians at my children's practice were actually residents at Children's National. So reading that parenting blog, I would feel like I know the doctors that came out of that training, and therefore I trust the doctors that are there, and I would want to hear what they have to say. Do you seasonally think about Halloween, Christmas, what to eat, how to explain Santa, all those things? Also, when stuff is coming up in the news around children's health, do you find like you send out one of your beat reporters and you're like, go cover this because people are looking for information on this issue?
We definitely lean into the seasonality because it's also what people are looking for. So it's back to school season's coming. What vaccines does your child need? Do you need any sports physicals, things like that? We also know it's helpful because, to your point earlier, I probably would not feel comfortable texting or calling my pediatrician to say, hey, is it okay if I let my kid eat a ton of candy on Halloween? Or which types of sunscreen might be the best? I think a lot of folks, you're either not going to be able to get that much out of the pediatrician because they're busy seeing patients, or you just might not feel comfortable. So this is giving you access to real pediatricians answering the questions that are not individualized to your child, but could still encapsulate what you need to know.
I think it's so important. I think, especially in a world where health information is just flying around and it's hard to know where to go, what to read, what to trust, to have something from an academic institution that's respected, that my own child was treated there for a blood disorder. I think that's a really important thing and resource that people have. We talked about, I would say 6 months ago, about AI and how you felt that at the time as a healthcare marketer, it was hard to get concrete information about what to do. Like everyone was describing the challenge, but nobody was telling you how to solve for it. In this past 6 months, do you feel like you've gotten clearer guidance?
I think it's gotten a lot better. I think we all know it's changing literally every single week. I think there's some things we can all fairly confidently lean into, and some of it's what we talked about earlier, authenticity, expertise, trust that existed before AI. That was always a big framework for why Google would surface certain results higher than others. So that's still big. Conversational queries, that's been a big shift. And we've been seeing that for a few years, even as like voice search was starting to get bigger. Now that's really on steroids. So a lot of content we're pivoting to still maintaining our brand guidelines. We're not going to talk overly conversational. We're still in a hospital, but instead of understanding flu symptoms, not
Yeah.
saying it would have been that, but had it been, it would now be what are symptoms of the flu? Things like that. So conversational queries are a biggie. It's tough because measurement is still a challenge. I don't know if you're hearing about that as much, but we're constantly looking into different ways that you can try to measure how you're performing in the different AI platforms. And it makes it a little trickier from what we had before because one other thing is page views are not as big of a deal now. They still
I was
matter.
going to ask you, have you had to educate your stakeholders about traffic and page views and understanding what it all really means now?
Yes, and it is complicated. There's that expression about you're still laying the tracks down while you're already on the train. That is honestly what it feels like because we can tell people page views, they don't necessarily mean what they used to. It's more about impressions, but I can't necessarily fully show you the picture on impressions yet because we're still putting that all together from a analysis standpoint. We are talking about that more internally, socializing that as a concept, explaining that to people. It's a change. And even with click-throughs, I think in healthcare, it's impacting us less than in some industries. It's situational. Like going back to our friend the flu, if you are someone who predominantly is producing just conditions and treatment page type content, you're going to take a big hit. But if you're a hospital, an academic medical center, it's a little bit different because there's still conversions. It's not just eyeballs on your website, it's what are people doing. So that's also something to focus on. Like we have online appointment scheduling, which has been a huge positive change for us in the last couple of years. And that's an area you can track and see actual conversions, but that's definitely another big change. It's not so much, we got a few clicks on XYZ. It's how often are you appearing in searches?
I've always said that all of those metrics are vanity metrics and conversions is where it's at. What I've told people who are very frustrated is use this as an opportunity to go to your stakeholders and say, can you please let us connect the pipes? You want us to measure this thing? Give us money to connect the pipes. Let us do online scheduling. Let us show you conversions. Give us more of an opportunity to prove to you that the work that we're doing is really important and pushing revenue for the system. I think that we just did a huge research study on this and we're doing a webinar about it. But I think what you're really going to find about AI search overviews is people are still going to click on pages, are going to go into depth about what they need to know. I really do. And I agree with you about the conditions, but if somebody's looking for a treatment, they're going to click on that page, especially as you talk about advancing disease states, metastatic cancer, God forbid, major neurodevelopmental diagnoses, autoimmune diseases. People need more information than what AI can provide to them. And they're still going to use conversational query, I think. I don't think that's going to change, but they're actually going to go to people also ask. It's a change, but it's not a disaster. I think it's an opportunity. And I think people should say it that way.
I agree with you. I think that's a really good way to describe it. And you're right, especially with certain conditions. I think it's that basic. What is it? What are symptoms of XYZ? Most of the time, you could probably satisfy that through a simple search, on an AI platform. But for anything else, or you already have a condition and you're living with it and managing it and you want to learn more, all of that content is absolutely relevant. And you're going to want to be able to share that with people.
Jen, thank you so much for joining me. It was really wonderful to have you here. And thanks to our viewers for joining us. I hope you got the answer you needed today. If you have a burning question, put it in the comments or email it to ahava.leibtag@ahamediagroup.com. We'll see you next time.